Hi, I am Dr. Lorraine Hill from Hampton Clinic and I'd like to explain how skin peels work. In order for me to do this, it really helps to explain a little bit of skin anatomy and how skin actually works. So I've drawn a diagram here to explain how skin works. This is a picture of the skin. We have two layers of skin. The first top layer of skin is known as the epidermis, and this is just lots and lots of skin cells at different stages of maturation. Underneath the epidermis, we have dermis, which is made up of all our collagen and our elastin. Between the two layers of skin cells, we have fibroblasts. These are very active cells that give birth to everything that our skin needs. It makes all the new skin cells, it makes collagen and elastin, and it makes all the hydration that we need in the epidermis. So these are all skin cells maturing, aging. As they age, they move up towards the surface of the skin. And once they reach the surface of the skin here, all these skin cells just die and they should flake off. So we shouldn't have a thick layer of dead skin cells on the surface. But as we age and with time and with damage to our skin, this dead layer of skin can build up and up and up. So we get a very thick layer of dead skin, which can lead to a really dull matte complexion. Over here we have a hair follicle, which starts in the dermis. Attached to each hair follicle is a sebaceous gland that produces oil. The hair follicle comes up through the epidermis and out through your pores. Oils made here come up the shaft of the hair follicle and will sit in the pores. They should just evaporate or wash off. But with all these dead skin cells that are building up, we're going to block the pores, and then the pores will get stretched and get larger. This is a pigment cell, and the pigment cell, known as a melanocyte, produces melanin, which is pigment. All this pigment, these red tendrils here, will intersperse between the skin cells, and a healthy skin, healthy pigment will just evenly spread through the skin, giving a nice tan to the skin. But problematic pigment can go on to cause freckling, sunspots, and melasma, which is very difficult pigment to treat. So pigment can go up into the epidermis, but it can also penetrate down into the dermis. So when it comes to skin peels, the indications for a skin peel can be just simply for a dull matte complexion, and we want to remove this top layer of dead surface skin cells. It might really have very large pores, and if we remove all the dead skin cells on the surface, then the oils can escape more easily and we're not stretching the pores quite so much. Peels can go to different depths, so we can just take this surface layer off, or we can start going a bit deeper and taking off layers down into the epidermis. So if you've got some pigmentation problems at this sort of level, a gentle peel can take off the top layer of the epidermis and improve pigmentation. But also at the same time, if we're going to take off the layer of the epidermis down to this layer, you'll see with our pigments, pores, they are cone shaped, and if we come down and down and down into the epidermis, the size of the pore is going to get smaller and smaller. So the more deeper we go with our peel, the smaller the pore size will become. So peels are great for your dull complexion, for your pore size, for your pigmentation problems. So general uneven tone, general photodamage to the sun, to the skin. So there's lots of damage to the skin from sun, from environmental pollution. All the pollution with free radicals is aging and damaging our skin. So all this textural damage can be improved with a skin peel. It can also help with mild wrinkles and general laxity. So there's generally three types of peel. They fall into three categories. So we have alpha hydroxy acids, beta hydroxy acids, and trichloroacetic acid. Within the alpha hydroxy acids, there's a number of different types of acids that we can use. We have lactic acid, glycolic acid, mandelic acid, kojic acid, citric acid. And in the beta hydroxy acids, we generally use salicylic acid, and then trichloroacetic acid is one on its own. Now we can combine different concentrations, different strengths, different volumes of each acid We can do a cocktail of mixing different acids. So you can have 1 or 2 alpha hydroxy acids mixed with the beta hydroxy acid, or the TCA might be mixed with a combination of a number of these different ones, all at different concentrations and different volumes, will all produce different types of peel. And a peel can be tailored to your individual problem. So within the Zedo skincare range, there are 6 different types of peels. We have 3 at-home peels and 3 in-clinic peels. For our at-home peel, the first peel we have is called enzymatic peel. This is a really gentle peel cream that actually doesn't give you any visible peeling. It's a mixture of the glycolic acid with protein and fruit enzymes. It's very gentle on the skin, and it's just going to take, with it being an alpha hydroxy acid, I think I forgot to say how they work. The alpha hydroxy acids, the cells here are joined together by bonds. So these alpha hydroxy acids are going to break all these bonds between the cells, allowing the cells to flake off. So with this enzymatic peel, being mainly glycolic acid based, it's breaking all these bonds between the cells, allowing these dead cells on the surface of the skin to flake off. So this gentle at-home peel is just going to take off this dead layer of skin, giving us a fresher and brighter complexion. But it's also going to allow better penetration of all your topical creams at home and accelerate your results for a really lovely fresh skin. The second at-home skin peel that we can use is something called Exfoliating Accelerator. And again, like our enzymatic peel, we're just going to put this on straight after our morning cream. So this is the Exfoliating Accelerator. 2 pumps of this will just go on all over the face immediately after your morning regime. This is a combination of 10% glycolic acid mixed with lactic acid to form a complex that is going to again take off all this surface dead skin cells. It's going to really stimulate new epidermal cells. It increases the cell turnover and makes this skin barrier much stronger. The third peel that we can do at home is called the Radical Night Repair Stimulator Peel. Now, Radical Night Repair is one of the retinols that we use in our normal skincare regime. It's a 1% retinol that we would normally apply 2 pumps at night. But if we're going to do the Radical Night Repair Stimulator Peel with this, we will take between 5 and 10 pumps morning and evening for anything from 3 to 5 days. Now, this is an extremely strong peel, and it really needs to be done under supervision from your Zedo Skin Health provider. It needs good preparation of your skin with a good skincare regime with retinol for 4 to 6 weeks before you would even contemplate something like this. And it also needs careful aftercare advice as well. You will get significant peeling. So on about day 3, maybe up to day 7, you're going to shed an awful lot of skin, and it's going to remove a significant amount of the epidermis. But at the same time, all that retinol gets right down into the dermis and stimulates your fibroblasts, gets them working really hard to produce more collagen, more elastin, more hyaluronic acid. So it gives you a fantastic radiant complexion. So this is an amazing peel to do at home. With the in-house clinic peels that we do, we have a choice of 3 peels. The first being what's called the Stimulator Peel. So this actually works as a really nice facial. It's a lovely treatment to come and have at the clinic, and you're going to have no downtime with it at all. It's a combination of a number of these alpha hydroxy acids. So it's going to break the bonds between these cells on the surface amongst all the dead cells, and you're going to lose all the dead cells on the surface of the skin, just giving you a lovely, fresh, glowing complexion. After the Stimulator Peel, we can then move on to the 3-step peel. So the 3-step peel is a peel that's done by myself. It's a doctor's peel, so it's much stronger. The 3-step peel is another peel that does require adequate preparation with using a very good skincare regime, including retinols, for at least 4 to 6 weeks before we do the peel. You also require lots of advice about the things you can and can't do leading up to the peel. So this requires a consultation on its own before we embark upon doing the treatment. So for the 3-step peel, it's a combination of your lactic acid, so it's 5% lactic acid, 17% of your salicylic acid, and 10% of your trichloroacetic acid. The lactic acid is going to break the bonds between the surface epithelial cells, and then the salicylic acid is actually dissolving the cells, and your trichloroacetic acid is coagulating the proteins further down. So with this peel, we're going to be taking off quite a significant layer of the epidermis. So it's a great peel for multiple indications of pigmentation problems, dull skin, laxity, large pores. So it's a very powerful treatment to really improve all aspects of your skin. After applying the combination of acids to your skin, we're then going to apply 6% retinol. So this gives us what we call dermal stimulation. So we're going to stimulate this layer, stimulate our fibroblasts. So we're going to get a massive boost of collagen, elastin and hyaluronic acid, giving you improved complexion for months to come. The final peel in the Sedo in clinic peels that we offer is the control depth peel. Now the control depth peel is a very intense peel for seriously problematic skin. Now with this peel we can take your skin layers right down to the dermis layer. So we can, the control depth peel is combined with a blue dye, so we can actually see how deep the peel is going. And we can tailor it so according to the severity of your problems, we can tailor it just so we're going to go into this sort of layer, the junction between the epidermis and the dermis. So we might just take the layers of skin off to that level. But if it's very problematic skin, which is often severe laxity and severe textural issues, scarring, or really bad pigmentation with melasma, where you've got very deep pigmentation into the dermis, we can go even deeper with the peel, removing skin layers right down to there, so we can get rid of all of this difficult pigmentation. This peel has significant downtime. Apart from going out with a blue face and looking blue for a few days, you're going to be peeling and looking sore and scabby and uncomfortable for up to possibly 2 weeks after this treatment. So there's a whole range of options of skin peels, from very, very gentle at home, gentle in clinic peels for just brightening your skin, to going all the way down to extremely deep peels with the control depth peel, treating very serious skin problems. But whatever your concerns, please just make a complimentary consultation appointment with myself and we can have a chat about all the different options. Thank you.